Joining me now is Dr. Marc Siegel. He is a Fox News medical contributor as well as the author of COVID, The Politics of Fear and the Power of Science. Dr. Siegel, thanks so much for joining me.
Hi, Samantha. Good to be back with you.
Yes, of course. Thanks so much for joining me again. And something that we've talked about in the past, and we're just going to jump right into talking about today, are these COVID-19 lockdowns. Now, over the last week or so, a number of mayors and governors throughout the country have said that they are going to start reopening. And notably, I want to mention New York Governor Andrew Cuomo tweeting that we simply cannot stay closed until the vaccine hits critical mass. The cost is too high. We will have nothing left to open. We must reopen the economy, but we must do it smartly and safely. What do you make of this?
I don't think he's been in Manhattan lately. I don't know what's left to reopen. Look at the streets of Manhattan. Granted, the construction workers are filling the potholes and there's a lot of activity in construction, but I don't see a lot of open restaurants. We don't have the opera. We don't have movies, obviously. I'm questioning how much is too far gone to reopen at this point. And, it may be that in New York City, there was some effect from the lockdowns in the early spring, but the key to lockdowns is across the board political posturing doesn't work if there's a lot of virus already in the community. That's the bottom line, and nobody's talking about that. In other words, if you're in a community with a lot of virus and you lock down, you're going to spread it within your households, which is most of where COVID-19 spreads anyway. It only takes one person to bring it into the household. And let's face it, if you're super rich, you can live in a mansion on the water and somebody jets in your food. But otherwise, you have to go out to get your food. The poorer you are, the more likely that you're going to encounter COVID and then bring it into your household. So lockdowns don't do the purpose they're intended to do. They have to be thought out on a case-by-case basis. Is that bar spreading COVID? Okay, close that bar. Is that restaurant spreading COVID? Let's look at the ventilation in that restaurant, because ventilation is an issue here.
Now, just along the same lines in talking about lockdowns not working, an international study that just came out actually points to the fact that the research failed to find an additional benefit of stay-at-home orders and business closures. What do you think of this? I know you touched a little bit on this in your last answer, but if people start opening right away, what impact will that have?
So the study you're talking about is out of Stanford University, and it compared the United States and the United Kingdom and Europe, where there are extensive lockdowns, with Sweden and South Korea, which have not. And what's interesting about South Korea is that they've really observed distancing, physical distancing, masking, and they have public health compliance. And I think that's the key. Another point to be made is countries like New Zealand and Australia, which really have had a very good result here, have done it through essentially travel restrictions, which have not been talked about enough. I mean, they're islands. You can close off your whole region, and then if you have a very low amount of COVID, it's not going to increase. United Arab Emirates actually has a policy where they haven't let anyone in without testing. And you can't travel from one region to the next without testing. Now, we're starting to do that in the United States now, but it's as though the horses are already out of the barn. Again, if you have a lot of COVID in your community, what's working is something called mitigating strategies. What mitigating strategies are masking, distancing, restricting travel, no large gatherings. No large gatherings. We've had tons of large gatherings in the United States on both sides of the political aisle, potentially super spreader events for COVID. So we need consistent public health compliance, not punitive lockdowns.
I heard that you actually got both doses of the vaccine. So can you talk a little bit about your experience with getting it and any side effects that you might have had?
Well, so as I wrote in my book, and this is a huge message, be more afraid of the virus than the vaccine. I'm out there treating this virus every day, and I'm seeing people that never fully get over it, that I gave Regeneron to, and then they're calling me, I still can't breathe properly. Can I have a CAT scan? I mean, I don't want to scare people about the virus because most people do recover from it, especially younger people. But it's a crapshoot with COVID-19. You may not fully recover from it. It may take a long time. Compare that to the vaccine. How can you be afraid of this vaccine when the vaccine is not even the virus? It's a tiny bit of genetic material. It doesn't stay in your body. It just alerts your cells, only a particular group of cells, by the way, dendritic cells, to make the proteins of the spike proteins of the virus, signaling your immune system. It looks like the immunity you get from the vaccine is as robust as potentially as the immunity you get from the virus. So you get all the benefit without the cost, without the risk. The risk is so low. You know, I got an email the other day from somebody who said, how could you be ignoring the 23 people who died in Norway? And I said, I said to myself, well, wait a minute. First of all, I don't know whether they died of the vaccine or not. I don't know what their risks were. I don't know whether the dosing was given properly. I don't know if it was frozen properly. But compare 23, the number 23, with the number 400,000. We're approaching 400,000 deaths in the United States. We have to look at the safety profile of the vaccine versus the safety profile of COVID-19, which is horrendous. And by the way, it looks like in the initial rollout of over 12 million people in the US, this may be one of the safest vaccines we've ever seen. After the first shot, I got a sore arm, and the next morning I woke up with a little bit of a headache. The second shot, which I just had about 5, 6 days ago, I didn't have as much of a sore arm, maybe a sore arm lasting for a day. The first time it lasted for a few days. And I had a tiny headache, but I would say that the next morning, about 12 hours later, I was a tiny bit wobbly with a small amount of muscle aches in my legs. Went away within a couple hours, did not miss a day of work, did not miss any time on television. You could watch my video clips from that day, and you'll say, "Well, he's a little sharper than ever. Maybe that vaccine helped him."
Well, Dr. Marc Siegel, as always, it's great to have you on. I always appreciate your insight, and of course, always welcome you back to come on and talk more about COVID-19 and the news of the day in the medical community. So thank you so much, Dr. Siegel.